Uganda will for the first time host over 500 delegates for the 11th International Congress of the Africa Society for Blood Transfusion to be held between 4th to 7th March 2024 under the theme Safe and Sustainable Blood Services in Africa, New Clinical Advances, ICT Innovation and Technologies in Transfusion. Speaking at the launch of the preparatory meetings, the Minister of Health, Dr. Jane Ruth Aceng, blamed the lack of policy governing blood services on the poor coordination of players in the sector.
You have been hiding. For that reason, I think I should first charge you with neglect of duty, because it is your duty to serve Ugandans. And so I have asked the chair of the scientific committee, when he gets time, to bring all of you in a line and introduce you one by one, and then you can give an accountability of what you have been doing and tell me how we are going to move forward.
She noted with concern that transfusion specialists under Uganda Blood Transfusion Services have not supported the ministry to come up with a policy.
If we can't sell life, why do we sell blood? For me, I need you to help me address some of those very challenging areas, wastage and so on, availability, accessibility, safety. We need a law to regulate blood in this country.
Dr. Aceng was happy that the international conference is coming at a time when the government is putting up a convention center at Munyonyo. It will accommodate blood transfusion specialists, policymakers and other key stakeholders in transfusion medicine and science. The executive director of Uganda Blood Transfusion Services, Dr. Dorothy Cheine Byabazaire, explained the expected benefits from hosting the congress.
It will lead to an exchange of knowledge in blood transfusion services, devise ways of sustaining blood transfusion services in Africa. I think many of us know we are struggling in blood transfusion services across Africa. And I think Uganda is second only to South Africa in the development of our transfusion services. It will also look into clinical approaches to blood transfusion, as well as new innovations and technologies in transfusion.
Uganda Blood Transfusion Services is a department under the Health Ministry that is responsible for ensuring appropriate use, availability and accessibility of all blood services in the country. However, there are challenges in blood collection, especially during holidays, since students are some of the biggest donors. This leaves many health facilities short of blood across the country. World Health Organization guidelines show that a country is considered self-sufficient of safe blood if it collects blood from at least 1% of its population. The Health Ministry and the Blood Transfusion Service called on the people to positively respond to blood donation exercises. Mary Prima Awor, Church of Uganda Family TV, News at 8.